hope keepers, living to make a difference. And there's nowhere like this, no, there's nowhere like this. And I love and living local. 13, there's nowhere else I'd rather be. Hey, those schools, and I love and living local. I'm living local and it's everything to me. We are the believers, we are the hope keepers.
Hi, everybody, and good afternoon. I'm Amy Hoyt with our 13 Now Live interview this afternoon, and our subject today is about breast cancer awareness. Tomorrow, as you know, is the 13th, and on the 13th of the month, we do buddy checks. We remind ladies to check for lumps in their breast to make sure that they don't have a lump, and if they do, of course, to go to their doctor and then seek out a mammogram. So we're going to speak today to someone who may be familiar to you. She is from Women's Imaging Center at Bay Radiology, Dr. Lindsay Weintritt-Davis. Good to see you. It's been a while.
Good to see you. Thank you for having me.
Now, you're our sponsor for Buddy Check, and it's very important. We do it every month, and there are some stories we'll tell later about women who've said, you know, they found the lump because we remind them to do the Buddy Check. So we're always proud to be a part of that. Tell us first, in case women aren't sure, how do you check for a lump? It's pretty simple. You know, once a month to do it.
It is. So we recommend that women do a self-breast exam, check your breast for breast cancer or lumps once a month. Typically about the week after your cycle, if you have regular cycles, is the best time to check. But really anytime, you can set a reminder on your phone. Anytime sort of the same time of every month is the best. And then you just use the tips of your fingers to check each place in the breast to see if there are any new lumps or bumps.
So you're just lightly kind of pressing
just
in a
press,
circle, right?
Right, yeah, sort of a gentle downward pressure to see if you notice any lumps. And in some women it can be kind of tricky, especially when you first start to identify what is normal. But the idea is if you check every month, the same time of the month, you over time will get to know sort of what normal feels like for you, so that if something new develops, then you notice the change, and that's what we really want to know about and when you should seek an exam with your doctor or a mammogram.
Right, and a self-exam is helpful because sometimes you'll notice it before maybe a machine might, or you might be younger than the average 40-year-old that they recommend getting a mammogram, correct?
Exactly. So it's definitely important to combine with an exam from your doctor, which typically we recommend to have at least once a year, and then once you're over age 40 to add a mammogram to that evaluation. But certainly in younger patients, the self-breast examination is critical.
Right, because early detection obviously saves lives. Correct?
Absolutely.
Right. Is it still 1 in 8 women will find a lump or have breast cancer?
Right. Over their lifetime, the statistics in our country are that 1 in every 8 women will get a diagnosis of a breast cancer. It's about 350,000 women each year in our country get a new diagnosis of breast cancer.
Wow. And I know they say it's hereditary, but there have been cases where it's not, correct?
Right. So having a family member, especially a first-degree family member, mom or sister, is definitely an increased risk factor. But actually, 9 out of 10 women who get diagnosed with breast cancer actually don't have a family history that they know of. So if you have a family history, we definitely want to know, and sometimes that will change how we recommend screening. But having no family history is definitely not protective, unfortunately.
Okay. Is 40 years old the age, the baseline age still?
Right. So that's the recommendation, to begin your first mammogram at age 40 and then have a mammogram every year going forward. In some women, if you have a family history, it's important to talk to your doctor about what age those family members were, because sometimes it may be necessary to begin earlier than age 40, but for average risk women, 40 is the starting point.
Now, if you have a mom or a grandmom, let's say, or maybe both, that have had breast cancer, what's the earliest a young woman should worry about it if it's that hereditary, about checking and getting mammograms?
Right. So we typically recommend that you get your first mammogram, if you have a family member, to start 10 years before their diagnosis. So if your mom was 38, for example, when she had breast cancer, we'd want to start screening at 28. Now, below 30, we often will do something like an ultrasound or an MRI. We don't usually do mammograms on women younger than 30, but we definitely want to know that and have a conversation with your doctor about a tailored screening approach. If you have a young family member. Now, if your mother or grandmother were in their 50s or 60s, we just still want to know that because it changes your risk, but it wouldn't change the age that you started having mammograms earlier than 40.
Right. And planning ahead and that early detection, We talk about that. Is it the BRCA gene that sometimes is detected and there's no lump, correct?
Right, right. So the BRCA testing is a blood test that they do to see if you carry a gene mutation. And patients with the BRCA, there are multiple gene mutations now that we know of, but BRCA is sort of the one that we're most familiar with, and that places patients at a much higher risk for developing a breast cancer. So it's more of a risk marker, knowing that you're at a very, very high risk for developing a breast cancer.
And there are different treatments. If you have that now, a lot of women choose to have a mastectomy or a double mastectomy, even though there's no lump. The BRCA gene is a guarantee you're going to get breast cancer.
It's very high. It's more than 85% chance. Right, and so some women will elect to have what we call a prophylactic mastectomy, sort of a mastectomy before a breast, knowing that they're at such a high risk, they choose to just have the breast tissue removed to, take that risk off the table.
Right. All right. Now, let's say you feel a lump. What's the next step?
So the next step is to call your doctor and perhaps get a physical exam, because sometimes lumps can be related to an infection. If you're a nursing mother, it could be related to breastfeeding. So to have a physical examination. And then often the next step will to have some imaging with a mammogram and usually an ultrasound. If you feel a lump, we almost always do a mammogram and combine it with ultrasound to look at that lump in two different ways to really evaluate the tissue thoroughly.
All right, let's talk about the mammogram.
Okay.
I've had a couple.
Yeah.
Which I'm overdue for one. I'll just admit that to you out loud for you and everybody else to hear. So it's time. But, I don't know how to explain it. When I did them, I assume it's the same way, where the breast is compressed between the two panels of glass on the machine, right? It's not fun.
Right.
But I think by the time you say, oh, whatever, it releases.
Right. Right. So the key there, the compression, the mammogram itself, the X-ray part is painless. Just like if you have an X-ray of your, a chest X-ray or a foot X-ray, you don't feel that. It's the compression. But the reason there is because, we're taking a two-dimensional picture of a three-dimensional structure, and the imaging with a mammogram is such fine detail that any motion on the image can cause blurriness where we might miss something small. So the idea with the compression is that it holds the tissue really, really still. And that's why they ask you to hold your breath, so there's no motion. And then it also spreads out the tissue so that nothing will hide, and all that pulling and tugging is to try to get all of the tissue on the image. If they don't pull your chest in very far, they can miss tissue that's against the chest wall muscles. And there might be a breast cancer there that we just couldn't see because we didn't pull it on. And so, no, it's definitely not comfortable, but I just had my very first one. Even though I've been doing this for years, I finally hit the mark. So I can attest that it's not pleasant, but it's not
you're
terribly painful. And like you said, it takes, it's a couple seconds, and then they release, and they do 2 pictures of each breast, typically, and you're in and out in 5-10 minutes.
It's very important. Now, let's talk about the fact that every woman is different. The size, the shape, and then there's something called a dense breast, where the skin or the body part is thicker, and there's another machine or a different type of test that is used for that, correct?
Right. So breast density is a phenomenon that we can only see on a mammogram, so it actually is not related to your breast size or firmness or perkiness, any of that. It's just when we look at the mammogram, we look to see how much breast tissue is there. So, the breast tissue on the mammogram shows up white, and in the background, we all have a certain amount of fat surrounding that breast tissue. So women who have our breast is mostly fat without very much of that white tissue, their mammograms are very clear and easy to read because breast cancer is also white. So in some patients who have more of that white glandular tissue, it's kind of in the way of looking for lumps or masses. And so in those patients, a mammogram can be less effective because that tissue can hide a developing cancer. So we found that adding ultrasound in addition to the mammogram still has value. It's just sometimes not enough to, with confidence, say there's absolutely nothing there. So we add ultrasound, which you can do with a traditional handheld ultrasound like you might have of other body parts, or there's a specialized machine now that's meant to screen the entire breast, where we can sort of look at the mammogram image of the whole breast and the ultrasound image of the whole breast together.
And I think we have some video that shows
I
the
think
actual
that'll be
machine,
helpful.
so you can see what it is. Now, do you offer this?
We do, and we recommend it for every woman who has dense tissue.
Okay, and this is a little bit different, as you'll see when it comes up with the patient in this video.
Yeah,
It's similar but different.
It's
'cause
still
you're
an
laying
ultrasound,
flat.
but
Right.
where she's holding that, you see that square device that kind of comes down.
Right.
It has, instead of the small ultrasound probe that the technologist uses by hand, it's a big wide probe, so it just kind of takes like a sweeping image of the breast so that they capture all the tissue. And the nice thing is that when the radiologist reads the mammogram, they've got a picture of the whole breast. So anywhere where there might be an area of concern on the mammogram, they have that ultrasound of that exact spot and can kind of put two and two together. And if there's still a question, then you may have to come back.
Right.
But it definitely can identify some small invasive cancers that just aren't visible in ladies with very dense tissue.
All right. Is there anything else that we're not asking, maybe? Questions you get from ladies who come in?
I think, the most common question and sort of confusion is when to start having mammograms and how often. And so I think it's just really important to drive home the fact that we want you to start at age 40 and then come every year. There have been some kind of different recommendations amongst different governing bodies, the American Cancer Society and the United States Preventative Services Task Force, where some patients, it's been a little confusing about what's the protocol. But the easiest thing to remember is just once a year, every year, starting at age 40.
Now, is that something we schedule ourselves, or do we go to our family physician and he writes you, not a note, but a prescription?
An order, right. So that's typically what's required. And then you just, call and schedule. And they may ask you if you've had previous mammograms, if we can see that you do have dense tissue, do you want to add the ultrasound to kind of make it a more complete exam when you schedule for a screening exam. And then I see you've got this little image here that sort of sorts out if you have, if you do feel a lump or you have a problem or you have some area that we've been watching, a diagnostic mammogram, it's the same exam. It's just that that's the type where we'll review it while you're in the office. We, can talk to you, can add an ultrasound if we need to really address your concern, versus a screening mammogram is if you have no issues, it's just time for your yearly check.
Okay. And this may not be a question for you, but insurance traditionally pays for these things, correct?
It does. We'll see, it's always evolving, but with the Affordable Care Act, insurance companies are required to cover a yearly screening mammogram. Sometimes with the diagnostic, or if you need an ultrasound, there is some out-of-pocket expense, but there should be no out-of-pocket expense for a screening mammogram.
All right. And the only other question I had was, we always talk about women because it's the majority, but men can get breast cancer too, right?
They can. It's about 1% of breast cancer cases, so it's a smaller number, but it's not zero. And so because it's a small number, they don't typically benefit from the screening test, where the odds are high, so we're checking constantly to make sure there's not something new. But certainly any man that feels a lump or pain or any changes in the breast or chest wall tissue, skin changes, skin dimpling, redness, all the same concerns that we talk about in women, they should see their doctor about that. And we can do we do mammograms on men when they have symptoms.
Right, of course. All right, Dr. Lindsay Weintraub-Davis, always good to see you.
You
We're going to have to
too.
do this again.
Absolutely.
As we prepare for Buddy Check, landed on a Saturday
Yes.
this month. It's tomorrow.
Yes,
So we'll all be wearing our pink tomorrow for breast cancer awareness. And we appreciate everything you do. And thanks for coming in.
Well, thank you. And we're happy to be a part of the Buddy Check program. I think it's really important.
Thank you so much.
Okay.
It is. All right,
Great.
everybody, have a great afternoon.
Thanks.
We are the believers, we are the hope keepers.